Hi everybody, my name is McKenzie.
I'm Courtney.
I'm Chris.
And we are going to be talking to you about hypertension. So what is hypertension? Hypertension is a fancy word for high blood pressure. Blood pressure is the pressure that our blood puts on blood vessels and artery walls as it's pumped throughout the body. Different lifestyle factors and physical factors can increase this blood pressure, which can overall affect all of the functions of our body. 1 in 3 U.S. adults are affected by high blood pressure. High blood pressure can go undetected for a long time, so it's important to see your primary care physician regularly so that this can be watched. As the blood pressure increases, over time it can start to cause damage to, like I said, overall body function and different organs.
In diagnosis of hypertension, there are different stages or classifications of the degree of hypertension. As you can see in this chart, it goes from normal, elevated, hypertension stage 1 to hypertension stage 2. Normal is a systolic, which is that top number that we will be talking about later on, of less than or equal to 120. And a diastolic, which is the last number, which we will talk about later, of less than 80. Elevated is a systolic pressure of 120 to 129, and a diastolic of less than 80. Hypertension stage 1 is a systolic pressure of 130 to 139, or a diastolic pressure of 80 to 89. Lastly, hypertension stage 2 is the most severe. It is a systolic pressure of greater than or equal to 140 or a diastolic pressure of greater than or equal to 90. As you can see here at the bottom of the chart, there is such thing as a hypertensive crisis. That is when the systolic blood pressure is higher than 180 and or the diastolic pressure is higher than 120. This is an emergency and your physician should be contacted at this point.
There are several things that are called risk factors that can contribute to having high blood pressure. Some of those are age. As we age, this increases. Alcohol consumption in excess, tobacco use, diabetes, elevated cholesterol, excess dietary sodium, gender. It's more prevalent in males from young to middle age and then more prevalent in women after the age of 64. A family history of high blood pressure and cardiac problems, obesity, ethnicity, sedentary lifestyle, a lower socioeconomic status, and stress. So how do we find out if we have hypertension? There are several diagnostic studies that your physician can do in order to make this diagnosis and to begin treatment. The first is an overall physical assessment and a interview to find out about these risk factors that you may have. Also, it includes a consistent monitoring and measurement of your blood pressure over time, a urinalysis, blood work to test kidney function, blood work to test your electrolytes and glucose levels, and blood work to check for high cholesterol. Also, there can be tests done on your heart, such as an electrocardiogram to check for your heart functioning and to check for any risk factors that may be present in your life.
Some symptoms of hypertension. There's not a lot of symptoms right off the bat. It's known as a silent killer because not a lot of symptoms happen. You can be asymptomatic until it targets organs specifically. It can have an increased workload on the heart, which may cause secondary symptoms such as fatigue, dizziness, palpitations, angina, which is chest pain, and dyspnea, which is shortness of breath. Some complications related to hypertension is the target organ disease, like I explained. You can have hypertensive heart disease, which is affecting your heart, cerebral vascular disease, which can affect your brain, peripheral vascular disease, which is your peripheral vessels, neurosclerosis, which is your kidneys, and retinal damage in your eyes. There's different ways to treat it. One major thing is periodic blood pressure monitoring, whether it's done at the clinic and also in your home. Sometimes they'll have you keep a record of daily blood pressure to make sure that it's being managed correctly. Nutritional therapy, they can put you on what's called a DASH diet, which can reduce sodium and is important to help reduce hypertension. Regular moderate exercise, which can help with weight loss, obesity, diabetes, different things that can also contribute to your hypertension. Also stopping any tobacco use and moderation of alcohol intake. Something that can contribute to hypertension is stress. So if you can manage your stress and come up with new techniques for that. There is antihypertensive drug therapy, so pharmacological therapy, and then finally just patient teaching and caregiver teaching. So if someone's caring for you, make sure that they know the signs and symptoms.
So some of those lifestyle modifications that she mentioned, big ones are dietary changes, smoking cessation, and change in your physical activity. So with those dietary changes, we're looking to reduce sodium intake and reduce cholesterol intake. And that will greatly decrease your chance of developing hypertension. So this means no canned foods, no highly processed foods that are high in salts, and no high carbohydrate foods which are high in sugars as well. That'll help to decrease that weight and help you thrive a little bit better. And as far as activity goes, we're looking for at least 30 minutes of activity, of moderate activity, 4 days a week. So that could include walking, going out, gardening, getting outside and moving around. That helps to decrease your chance for hypertension as well. Another lifestyle modification, as was mentioned, is tobacco cessation. So tobacco and nicotine products, they harden the arteries and blood vessels, and that does cause that heart to pump a little harder to pump against that pressure that's being put on those arteries. So tobacco cessation is important. There are programs for that. There are different methods that we can use to reduce your tobacco use. Another lifestyle modification is managing your stress. So with that, there's meditation, there is mindfulness, there are a lot of different things you can do, deep breathing techniques, and that helps bring down that heart rate, and it helps relax your body, and helps bring down, helps decrease your chance of developing hypertension as you grow older. So there are not many symptoms that you will see when you have early stages of hypertension, but you should seek help if your vision starts getting blurry, you start getting major headaches, you get heart palpitations, chest pain, shortness of breath, confusion, and if your blood pressure is out of ranges for what your healthcare provider has set for you. These are the late manifestations of hypertension, and the best action that you can take is preventative action and getting those regular checkups with your physician or healthcare provider, and making sure you chart and trend your blood pressures at home. And that brings me to how to take your blood pressure at home. So there are electronic blood pressure cuffs, and there are those are easy to use. You wrap the cuff around the arm, make sure it's positioned correctly. And then whenever you are taking your blood pressure, make sure your feet are flat on the floor. You're sitting straight up, arm is elevated at heart height, and that will get the most accurate reading for you, so your provider can tell what's going on. But if you're taking it manually, again, you do want the right size cuff, and your provider will work with you to get that for you. So the cuff wraps around the arm, nice and snug, and secures back to the Velcro there. And there are artery markers on there. You just want to make sure it's over that artery on the inside of your arm. And so when inflating the cuff, you're going to inflate to 20 to 30 past what the systolic blood pressure usually is. And you can note that by noting when your heartbeat stops, if you're listening with a stethoscope or if you're feeling it. Once you feel that pulse stop, you go 20 to 30 past that. So. Then once you get past that, you release slowly. And then if you're using a stethoscope, you'll hear the first heartbeat sound, and that's the number you'll mark on top as the systolic blood pressure. And then once you stop hearing the heartbeat or the last sound you hear, that is what you'll mark as the diastolic blood pressure. And once you do mark those blood pressures down, just make sure to chart those and keep a good log for your physician. And when you are taking your blood pressure at home, make sure to take it at the same time consistently every day, just to get accurate trends for that.
If you find yourself wanting to know more information regarding hypertension after this presentation, there are many resources out there for you. Among the more reliable resources next to your primary care physician would be the American Heart Association. Their website can be found at www.heart.org. There are many tools and resources on their website, such as blood pressure logs, a guide for talking with your healthcare provider, life check worksheets, information, and additional support. So check it out.
Okay, well, thanks for joining us today as we talked about hypertension. If you have any additional questions, be sure to reach out to your primary care physician.